Thank you for coming to our presentation. I'm Bae Sung-moon, major in financial accounting. In this presentation, I take introduction and conclusion parts. Have you ever heard about global citizenship? I think you may have seen or heard about global citizenship in a lecture or news or otherwise. But many people don't understand about global citizenship and even they are not interested in. So in this presentation, we explain about global citizenship by focusing on global issues. Before we start our presentation, these are the table of contents of our presentation. First, in internal part, we explain what global citizenship is. And next, in body part, we explain about global citizenship by especially focusing on refugee issues, pandemic, and global health issues. In component part, we suggest 5 ways to react about global issues. And next is references, and next is Q&A time. First, what is global citizenship? We can easily understand about global citizenship by comparing citizenship and global citizenship. Citizenship means following a particular group's basic norms and consciousness and responsibility as a group member. Otherwise, global citizenship means acting responsibly in global issues as a human community members. In other words, global citizenship is a bigger concept than citizenship. And also, global citizenship have 5 key points. First is global belonging. We recognize oneself as not only a particular group's member, but also a human community's member. Second is global responsibility. We feel obligation to react about global issue as a human community's member. Third is connected world. We understand the world is interconnected in terms of economy, environment, and other things. First is respecting for equality. Equality. We must value the right and the dignity of human beyond races and other things. Last is willing to act. We must react about global citizenship actively more than other people. Next part is refugee issues. Min Jung will explain about it.
To understand global citizenship, I would like to introduce global issues. In connect with my major in law, then let's start refugee issues. Today, many people are leaving their homes because of climate change, wars, and political problems. The number of refugees is the highest ever, showing how serious the global crisis is. Here are some examples. As fighting between Israel and Lebanon became worse, more than 100,000 people crossed into Syria. And in Haiti, gang violence became worse. So serious human rights abuses, including sexual violence, also increased. Then let's look at the laws related to refugees. First, there is Refugee International Law. Refugee is someone harmed because of their race, religion, or political opinion. This law says refugees can be returned to where their life or freedom might be in danger. And even if refugees enter a country illegally, they should be protected. Then let's look at the laws. Let's look at the Refugee Act of Korea. The South Korea is the first country in Asia to create an independent refugee act. The core principle is the non-refoulement rule. It means refugees can't be returned to a country in danger. And South Korea has refugee screening system. So even if someone is not recognized as refugee, they can stay for humanitarian reasons. And let's look at the problems in South Korea's refugee system. This survey is annual refugee application statistics. In this survey, the number of refugee applications were steadily increased, reaching about 18,000, the highest ever. However, only around 1% were officially recognized as refugees. Therefore, most people only get humanitarian stay, and the review takes more than a year, so the process is not fast as it should be. So what do you think about refugees? Let's look at the public opinion in South Korea. About 55% support accepting more refugees, which is lower than global average. Next, there is survey question: should the government's refugee acceptance policy continue? More than half of Koreans are fine with current refugees to stay, but they don't want to accept more refugees. So perception of refugees in Korea is not great. Finally, as a solution, let's look at the private sponsorship of refugees. Search for PSR is a global of Canada's refugee policy. This program allows private sponsors like citizens, religious groups, and community organizations to directly support refugees. This program reduces the government's financial burden, so refugees can adapt and find their jobs more quickly thanks to private sponsors. As member of global community, refugees can live safely only when we practice global citizenship. That was refugee issues. And next, Soyeon will talk about pandemic.
Before I begin, let me ask you a question. Have you ever thought about how deeply connected our world becomes during a pandemic like COVID-19? Now, we would like to explore how COVID-19 revealed this deep interconnection and why global cooperation becomes important than ever. So before we look at its global impact, let me briefly explain how COVID-19 first emerged and spread. The first report of the COVID-19 virus appeared on November 17, 2019 in Wuhan, China. The initial confirmed cases were mostly concentrated in China. However, starting from March 2020, the virus spread faster outside of China. According to the WHO, there were approximately 10,000 COVID-19 infections outside China at that time. The rapid increase was driven by a complex chain of human-to-human transmission. The pandemic revealed the deep interconnection of modern society. The virus spread without regard for national borders. Regional containment failures quickly led to global transmission. But the world realized that the national level responses alone are insufficient to address global problems. The pandemic awakened a stronger sense of global citizenship. First, a sense of responsibility. Did everyone experience social distancing, like maintaining 6-foot distance during COVID-19 period? I also remember going to school only every other week and eating lunch far apart from my friends. Experiences like this made many of us realize how closely connected our world, and the pandemic awakened a stronger sense of responsibility. Mask wearing, social distancing, and vaccination became civic duties to protect others. The pandemic also laid the foundation for international cooperation. The COVAX program, an initiative international vaccine program, worked to pursue global vaccine worldwide and support for lower income countries. They provided free doses and supported to 19 to lower income countries, demonstrating the global solidarity that went beyond the limits of individual government policies. As shown in this image from official COVAX website, these are the key achievements what COVAX has made. In discussing global cooperation, it becomes clear that effective communication through language is essential. Effective global health governance relies on shared recognition and accurate information sharing. It also requires joint goal setting and diplomatic negotiation. The Global Pandemic Treaty proposed by the WHO is an international code of conduct for pandemic prevention and response. It aims to ensure the equitable distribution of vaccines, treatments, and diagnostic technologies during future pandemics. As I focused on this topic from my major, English language, it naturally leads to the role of English. English functions as the global lingua franca and plays a crucial role for the legal and diplomatic procedure. In the end, the pandemic awakened a global citizenship, and the shared sense of responsibility are essential for addressing global problems. With this foundation in mind, I will now hand it over to Eunji, who will continue to explain global health issues we face today.
Well, to follow the previous issues, I will introduce the global health issues firstly or escalation. At first, we understand the first two channels here for emergence infectious diseases and two previous causes or causes and periods and types available. Here, I will show the chart, two causes or the versus corpus is to the word, the status and the part of patient, the sport and causes or causes in the word. And then, we can understand the World Health Organizations. We can call that WHO. We can see that first states and first especially says an international here first as shortest in the world. And then we short responsibility for international public health is that for that extract in the world. And then we can see versus was actually just good. It set the international health standards. It translates for established emergency here. The sport causes and support tests and choices assistance. There are two the pie charts. The pie chart is show exactly the main test that sorted the challenge at first stage and causes for the sense of the case of patient. Two rules play healthy here. The international health regulations. We can call that ICT. ICT are the most of the rules that remain here. That's practice the request here for post that all of the work the citizen have to do that first. We can see that here. This is international agreement. So the international script is for helpers and touches counterpart to the citizens helpers in the world. So that's it for we can see that's exactly what to do. That's the limitizer, the health events over here, the standard for the member states. They also to the pie chart. I will just to the pie chart. So the main data that who first state a person in the world stages and tested and choices and abilities. For that, we can say that understand the global health responsibilities. Responsibilities that who first comply with devices control regulation, share the information stress here, the support the health compass and understand international law with health. That's like, so we can call that IXR and WHO rules. That's export of responsibilities. So to make the inclusion, so who would we have first to message?
In components part, it suggests 5 ways to react about global issues. First is inclusive society. We integrate refugee people into our community by settlement programs. Second is enhancing global cooperation. We strengthen connection between nations, inter-organization, and NGOs to respond effectively about global issues. Third is responsible action and prevention. We let people act responsibly in global issues by considering their global impact, and also must make prevention policy based on past information such as COVID or Ebola. Fourth is protecting vulnerable people and promoting equity. We must give priority to providing healthcare and vaccine programs to vulnerable people such as low-income group, and also must make prevention policy through past information. Last is establish sustainable systems. We must make non-profit organizations to withstand future global crises. Next part is references. And next part is Q&A time. Anyone have question? If there is no question about our presentation, we will finish our presentation. Thank you for listening.